Let me invoke both ends of the spectrum. First, a celebratory note. The release of the 21 Chibok girls from the clutches of Boko Haram who abducted them, believe it or not, more than 2.5 years ago. I hate to think what happened to those girls in the interim, but at least they're free. There are still 197 girls in captivity, but this is a glimmer of hope. Mind you, it's tempered slightly by the recognition that Boko Haram has caused such ravages in northern Nigeria that close to 3 million people now face famine of a kind that hasn't been seen in recent Nigerian history. Now the other end of the spectrum, rather less celebratory, and that is the question of the new annual report on tuberculosis released by the World Health Organization, indicating that last year more than 10 million people fell ill with the disease. That's almost a million more than the year before by way of an estimate. And some 1,800,000 people died. Again, some 300,000 more than the year before by way of an estimate. I say estimate because it's all underestimated. There's no way so far of carefully indicating the numbers who are fighting to survive with tuberculosis. You know, one of the experts wrote an op-ed and said that there is a death from TB every 18 seconds. I'm not one who likes these arithmetic formulations, but it stopped me short. It stopped me short because when I thought of it, it means that during the course of this commentary, a minimum of 10 people will die from tuberculosis. And it's not just general tuberculosis. It's also this terrifying infectious disease of multi-drug resistant tuberculosis. Tuberculosis is resistant to all of the existing drugs, and the new drugs that are coming online are not available, partly because of price, partly because of pharmaceutical companies, partly because of obdurate governments. But in any event, more than 500,000 people have multi-drug resistant tuberculosis. The prognosis is terribly bad for all of them, and believe it or not even 1/4 of them are receiving any kind of treatment. And tuberculosis is in countries that have resources to deal with it. I mean, countries like Russia, China, India, Indonesia, Brazil, South Africa. This is where tuberculosis has taken its greatest grip. They should have the resources, but as always, we have a terrible shortfall. Something like $4 billion additional dollars required now to deal with tuberculosis this year, the treatment and the research and development. You know, I was trying to think of a comparison. I was trying to think of a juxtaposition, and a couple of weeks ago, the renowned economist Jeffrey Sachs did a fascinating calculation of what the United States is spending on the military alone. He looked at the Pentagon, the CIA, Homeland Security, nuclear weapons development independent of the Pentagon, and money spent on programs for war veterans, and it added up to $900 billion annually. $4 billion represents less than 0.5% of that. Extraordinary. I have two last things to say. First, TB is a curable disease. This should not be happening. It often relates to HIV and AIDS as co-infection, and in fact, the majority of people who die of HIV and AIDS, or the single greatest killer in HIV and AIDS, is tuberculosis, but it need not be happening. We can cure it. This is an ugly atrocity in the world of global public health that we haven't come to grips with. And the second thing is that I have to be wary of these abstractions. What's happening with TB is that the people who die, they die terribly painful, agonizing, sometimes blood-drenched deaths. It's as though we have created a culture of loss which has no room for compassion. Just think of it. 1,800,000 people dying from tuberculosis unnecessarily. No, I'm wrong. That's an exaggeration. It's not 1,800,000. It's fewer in number. 10 of those people have died during the course of this commentary. That was last week. I'm Stephen Lewis.